So let's talk about ivermectin and how this whole thing got started. It seems to go back to April of 2021. And during India's big breakout, they listed ivermectin as a possible drug to use as a treatment. Now, technically, there was a decrease in COVID cases after ivermectin was introduced into their guidelines. But that by itself is misleading. Here's why. First of all, just because it was on the guidelines doesn't mean that every patient was treated with ivermectin. This just means that some doctors treated some of their patients with ivermectin, along with a variety of other COVID treatments, some of which are recommended by the World Health Organization, some of which were not. As you can see from this graph, with the blue line representing where ivermectin was added into their guidelines, they did technically have a decrease in COVID numbers, but only after about 10 days of increasing COVID numbers. But the bottom line is they didn't isolate enough variables to show that ivermectin was the cause of this decrease, especially when you compare a similar graph from Peru. When they added ivermectin into their guidelines, their COVID numbers just kind of went all over the place after that. So no, there is no evidence that ivermectin is a viable treatment for COVID. What it has done is fill up much-needed hospital beds with idiots who decided to take a deworming medication in a dose recommended for an animal 8 times their size.